name is Jasmine Shadding. I'm with Harris County Public Health Department. In my usual role, I am the Diversity and Inclusion Training Specialist. But since we are in the midst of a global health crisis, Harris County Public Health has raised an emergency response structure. And so underneath that structure, I am working under the Community Resilience and Health Equity branch. And so I'll explain a little bit more about what that is in a moment. And also in this presentation, I will be sharing what Harris County Public Health is doing to respond to the COVID-19 pandemic. There are many moving parts to our response, so I'll do my best to just highlight the key areas so you can see some of the behind the scenes and even share this with individuals that you serve, and hopefully this will kind of ease some anxiety just knowing that there are many people behind the scenes that are working to allow the public the best health that they can have at this time. So we'll go ahead and get into it. Let's see. How do I go to the next screen? Okay, so I wanted to just tell you a little bit about Harris County Public Health, because as I've been doing community outreach, I've realized there's a lot of confusion about what our organization is, especially since we have Harris Health Systems and the City of Houston's Health Department. But Harris County Public Health is the public health department for the county. Many of you may know that Harris County is the most populous county in Texas, and actually the fourth most populous county in the United States, with a population of over 4 million people. So with that being said, Harris County not only incorporates the city of Houston, but surrounding areas as well, like Cypress, Spring, Humboldt, Pasadena, Tomball. So we are a very large county. So our mission here at Harris County Public Health is to promote a healthy and safe community, and we do this through our cornerstone values of innovation, engagement, and equity. So you'll be hearing that word equity a few times during this this presentation, seeing as how that is the branch that I'm working under in this response. So again, Harris County Public Health is not to be confused with Harris Health or the City of Houston's Health Department. We are for the county. And here I just have some visual representations of all of our different departments that we have here at Harris County Public Health. So in normal times, we're working behind the scenes to provide all kinds of services for the county, actually, but definitely in this response, this department here, the Office of Public Health Preparedness and Response, is taking the lead and really delegating different tasks to our employees to make sure that we are providing a good response. So they also, when Harvey happened, again, that was the Public Health Preparedness and Response Department. And even our Office of Science, Surveillance, and Technology houses our epidemiology unit that watches the spread of the virus and things like that. So very large organization. We do a lot of things to help the community because we believe that everyone should have an opportunity to achieve their best health. On our Harris County Public Health website, you will find this dashboard, which shows updated data information regarding COVID-19. So if you're someone who likes to see the numbers and how they're progressing, just for your own knowledge, this is a great place to go for reliable information. The website is here, publichealth.harriscountytx.gov. So here we have all of our, as about noon today, combined cases with the city. So these numbers include both the county and the city's data here. So about 3,200 active cases. That's not going to include the recovered cases and the death count as well. But if you are interested in seeing Harris County on its own, you can click this tab. And if you'd like to see just the City of Houston data on its own, you can click this tab. So I'm going to reference this site a few times in this presentation because it is the place that we are encouraging people to go for accurate and reliable information. And this is updated many, many times throughout the day. So you will be able to find that information here. Now, to just tell you about the activities that we are doing at Harris County Public Health, I mentioned the emergency response structure before, which is one of the major developments. And basically, this just means that employees are working outside of their normal roles to respond directly to the health emergency. And it's a really interesting thing to see happen behind the scenes. I'm new to public health, and I was told about this when I was hired. We're actually considered first responders because that's how deeply our work is going into the response. So again, I'm with the Resilience and Health Equity branch. And basically what we do is we are a team of about 3, so quite small for the amount of work we do, but we develop and inform the growth of solutions that reduce inequities in our communities. To do this, we use prior and current COVID-19 data to really understand the impact of COVID-19 on populations that have historically experienced poor health and social outcomes. Some of the work we've done includes research and recommendations for the non-congregate medical shelter at NRG Park, which I'll discuss a little bit later. And we've also researched and provide recommendations for low cost and free testing sites in different areas of Harris County and Houston, just to make sure that we are placing these sites in areas with the most need. We also work with our communications branch to deliver inclusive messaging to different marginalized and high-risk populations, such as persons experiencing homelessness, aging populations, communities of color, people living with disabilities, and homebound residents, our LGBTQ organizations, and of course, faith-based organizations. We really want to be able to hear the community voice and push that voice upwards to the people who are making the decisions. So that is just solely the Resilience and Health Equity branch, but we do have some high-level frontline activities going on as well that you will hear in the news, or may have used some of these yourself already. Our mobile testing sites, we've actually just expanded from being able to do 500 tests daily to 1,000 tests daily between the 2 stationary sites in Katy and Baytown. And these are drive-through sites that we basically raised up towards the beginning of the response. And we've been testing a lot of people through these drive-through testing sites. More recently, we've actually are standing up pop-up or roving sites that will move to different precincts in the county. They will be starting at Humble and Tomball, and then will eventually reach every precinct. Also, Judge Hidalgo just announced today that we have paired with private sector and are now going to be able to have testing at Walgreens. There are 2 locations for this. One is in the city of Houston, and the other is going to be in Pasadena. And through these testings, each of those sites will be able to deliver 200 rapid tests a day. These rapid tests are great because they will deliver the status to the technicians within 15 minutes. So the patients will be able to receive their results in 24 hours, which is huge because it's been taking a few days. So that is definitely something that is to celebrate. We also have field testing we just rolled out for homebound individuals or people that have limited transportation to be able to fill that gap. And the biggest, I think, response that we've created is the non-congregate medical shelter at NRG Park. And this is really a proactive solution in a worst case scenario that the hospitals are overwhelmed. We'll be able to build out capacity in this shelter. So right now there's about 250 beds there to start off, and there's a capacity for about 200 beds. So for all of these sites, it is going to be, prioritized for people who are considered high risk. So for the testing sites, you will have to go through screening before. You can't just show up at the sites. They want to make sure that you have symptoms, and then there's a process for that, which I will explain to you later. And for the medical shelter, they are coming directly from hospitals, so hospitals are providing that. And then, as I mentioned before, we have communication to different populations. The best way to get Harris County Public Health communication is on our website and through social media, which I'll show you later as well. So if you do need to determine if you qualify for the free testing that Harris County and the City of Houston offers, you can go to the website here, readyharris.org, or if you don't have access to the internet, you can call this number. But this is to use the self-assessment to determine whether you need to be tested for COVID-19. There are 3 steps to be tested. The first is the online screening through the link that I just provided. From there, you will be given a unique number and code to have a phone consultation. If you're deemed at risk, you will then be moved to step 3 and you will be given information to a testing facility. So this process has already been going on for a few weeks now. We've been able to test a great deal of people through this method. And as I just told you, we've even expanded it beyond that. So it's really great news to be able to have so much testing, because that is what is going to help us get through this. In addition to the Harris County testing, the Texas Department of State Health Services has a dashboard which shows all the drive-through testing locations in Texas. Some of these do require insurance and some are low cost, but this is a pretty good dashboard if you'd like to see where they're all located, and this is updated as often as we can. Really quickly, I'm going to talk about the stay-at-home work safe order. The intent behind this order is to drastically limit public gatherings and activities in order to flatten the curve. It has been extended until April 30th. It is possible that it may be extended beyond that, which I know gives us anxiety and worry to think about. But it's really our role to follow this order as best we can to flatten the curve. So you must stay home, as many of you know, except for essential businesses and if you have to travel to work. If you need food and house supplies, of course, you can leave for that. It is recommended to go to the grocery store alone if you can, just to reduce the amount of people in the stores. And you can also, which I like to encourage people, that you can leave for outdoor activity as long as you're maintaining social distancing. So that is why the parks are still open. You can sit outside on your porch if that's what you want. So some people don't know that. So you can go outside for exercise to walk around as long as you're not in a crowded area. And there is actually this website here and this email address. If you have more questions about where you can go, what you can do, you can go to this website, and it's really helpful to clear up any communication for the stay-at-home order. Now that I've talked about all that technical stuff, I'm sure you're thinking, but we've already been home for a month now, and you might be feeling like you're losing steam, but it is important to remain vigilant in order to flatten the curve. We don't have an update at the moment for when things will be back to normal. We are still waiting for numbers to either peak or plateau, and we haven't seen either of these yet. So we're very much still in the thick of things, and we need everyone's help in order to flatten the curve. So maintaining physical, mental, and spiritual health is really important. And I just say, find a way to make the best out of the current situation. We know we're going to be in it for a while. So, if that involves reading a book, if that involves learning a few words in a new language, for me, it's just been trying to get more flexible and touch my toes, which I couldn't do a week ago, and now I can do. So it's just finding little things that you can do, even if you are staying at home. I like to tell people, since you can't go out, go in, not inside your house, but inside yourself. This third point here, I tell my mom every day, is to minimize watching or listening to news about COVID-19 if it's making you feel anxious or distressed, and only doing so once or twice a day or even once or twice a week. and utilizing the technology that we have. YouTube has been a great resource. There's webinars such as this that will make you more at ease. So like I said, if that, means that you just Google things that you've always wanted to know but hadn't had time to research, now you can, and you'll feel better at the end of the day just knowing you learned something new. Here we have all the community resources for Harris County Public Health, as well as a few other resources here. And I will be providing this to Stuart, and he can share this with you afterwards, because I know there's a lot of information here. But if you are looking for, again, accurate information, you can definitely go to our website. We have a whole page dedicated to COVID-19. Here under the Community Resources tab, you'll find information in all different languages for all different types of residents in the county. And also on Instagram, Twitter, and Facebook, we are constantly posting messaging to the community. So you can follow us on any one of these social media platforms, share this with the individuals that you serve if they would like to stay updated. And lastly, we do have a hotline for any general questions or concerns, and the number is listed there. Again, I will share this presentation so you will have all of this information.